Make mealtime a good time. Made in Texas, with more nutrients and protein in every cup and wholesome, sustainable ingredients. Every bite of Canaday is a world of goodness for pets and the planet. Canaday!
Girls, we want to meet you where you are. Welcome to Dare to Ask. Episode 1, a robot goes in my what?
You know, it's not like everyday conversation. Okay, that you wouldn't know that.
I'm Cori Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with a woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Cori Jensen and sponsored by Essentia Health.
Wait a second. I am a doctor.
My guest today is an incredible girl boss who so happens to be a department head and also does surgery. I got such women empowerment vibes from this talk with Dr. Stefanie Gefroh Ellison. We covered some very personal ground, professionally specializing in fertility, gynecological surgery, gynecology, obstetrics at Essentia Health in Fargo, graduated from West Fargo High School, went to UND Medical School. What's interesting is we find where her specialty is also is something she experienced firsthand. And we're going to talk about some really exciting advancements in robotics in the vagina. I know what you're thinking, and so am I. And I'm going to ask it.
Thanks for having me today.
Right out of the gates. What's your favorite color?
It's kind of boring gray.
I love gray.
Gray these days.
What a great way to put it. Do you wish your scrubs came in gray?
I never thought about that.
Maybe that would be too much.
I mean, it's a nice color that doesn't light up all of the stuff that ends up on your scrubs.
Good point.
Yeah.
Really good point. Okay. Today we get the opportunity to talk about gynecological services and health. And we're going to get real in the whole women's realm of health. So my guest today is Dr. Stefanie Gefroh. Dr. Gefroh, will you please share where you work, what your department's like, and give kind of a brief synopsis of all of the areas that you have expertise in?
Oh, sure. So I am an OBGYN at Essentia Health here in Fargo. I actually split my time clinically and then administratively, but the clinical part is obviously a big part of my passion. I see patients of all ages and a variety of different, women's health issues, a lot of well women visits. So, those are typically just going through how was the last year, any new concerns, where are you at with your cycles, those kind of things. And then sometimes people come in with problems and concerns that are more focused. So we may talk about your bladder health. We may talk about if it feels like things are shifting either hormonally or anatomically. And sometimes patients are referred for a specific reason. Maybe they've been working with their primary care provider and maybe they're referred to talk about surgery. And sometimes, pregnancy, thinking about getting pregnant, or maybe they're having difficulty getting pregnant and maybe they already are.
And fertility is one of your specialties as well. And I know that plays such a huge role in your passion. Part of your story just as a woman, which was one of the reasons why I just love this podcast already in its infancy, that we have the opportunity to sit down and chat like we were having coffee or wine, which, by the way, are you a red or a white wine?
I don't drink.
Good for you. And also, I'm sorry. No. A little bit of a wine girl over here, and I do prefer red.
I like to watch others. It's very entertaining.
That is true. I'll give you that one, too. That's very true. Can I ask a really personal question?
Sure.
Because drinking and fertility, usually one of those big linked things. Is that one of the reasons why you decided not so much because of wanting to get pregnant?
Actually, I got sober. It's been 11 years ago now. So unrelated to fertility, but just part of my story. And it was a scary step at the time, but one of the best divine interventions that could have ever come about in my life, because making that decision to do that one day at a time has paid off in dividends.
Thank you. Thanks for sharing that with me. Sometimes we just need to hear it, especially from a successful woman who's also a mama. And you just need to hear those things to help you make your next step. Can I ask you about your kiddos? Because you have twins.
I do.
Will you tell the story of how your little ones and what their names came to be?
So I have 4-year-old twins. I have a boy and a girl. Our little girl is Landon, and our little boy is Beckett. And
I have a Beckett too. I love it.
It's a very common name.
Really
we kind of had it in our back pocket when we first started dating, because there was a picture on the Red Sox that we liked.
Oh, fun.
And so we always, we're going to have a Beckett. And then I would see these patients come in and have babies, and they're like, what are you naming? Beckett James. Oh, Beckett James. And that's my name. Once you decide that that's going to be their name, you just can't see them as anything else.
So true.
So he's a Beckett, and our Landon is our little Lanny, we call her. And they're just, it's the hardest, best thing I've ever done. And it wasn't easy. We got married 9 years ago now, and we took time. We've known each other since high school. We weren't together or anything, but we connected at a social event later in life and started dating and got married. And like a lot of people, you just think you have all this time to start a family. And we were just enjoying being together. We traveled a lot. We, even in our wedding vows, we said that one of our commitments to each other was we were going to get to all of the major league baseball stadioms over the course of our marriage. And, we did get to several before we had our kids, but we haven't been back since the kids have been born.
When we were innocent and we made those big dream plans.
Yes, we'll get back there, and now we'll be able to take our kids with us. So that's something that we look forward to. When we made the decision to start trying for our family, I just, made this assumption that it was going to be simple and easy. We spend a lot of our relationship trying to plan out those things and time it just right. And
of course.
So then you feel like once you make that decision, it's going to just happen, right?
Right.
Yeah. And so, and I thought I'm youngish, 38, I think, when we started, and I didn't think that it was going to be an issue. And, my little sister was born when my mom was 41.
You had every reason.
I had every reason to think that it was going to just happen.
You're an able-bodied, very healthy woman, like the sobriety, you had all signs point to yes. If we were to shake the 8-ball, all signs point to yes.
Yeah.
You're also a professional in this field, and fertility is something that you already know about.
Sure.
So then here, your own real life, you're placed in your lap, a question of, is this really going to be as easy as I thought it was?
Yeah. Yeah. That was kind of a curveball for me. I mean, we started trying, and at least I knew enough to have some awareness that we didn't try too long before we sought some help, just because I have told my patients that the closer you get to age 40 is really when we see some bigger declines in pregnancy rates. And so I knew that was approaching. And so we had a consultation. We walked away both just feeling so overwhelmed.
Oh, yeah.
And wondering, how does anyone get pregnant, really? There's nothing blowing your mind in seeing the statistics of, what the pregnancy rates are, not only by age and, all of these things that they sort out for you. But at the end, basically we had hope. And so we continued on. And when we got to the point where do we want to do IVF, we were doing medications just that you take by mouth initially, and then doing artificial insemination, and weren't getting pregnant. So we made the decision to do IVF. And I think that's the other thing that I was a little bit naive about, that I just thought, well, that's absolutely going to work. I mean,
bullseye.
it's going to happen. It wasn't an easy journey. We did go through 3 or 4 rounds of IV. I have to think back. I know you kind of forget about.
You know what?
Like,
Isn't it? That
time.
mommy amnesia stuff is real, and I swear to it.
Yeah. It was 4 cycles before we were successful, but the first cycle was canceled because I didn't respond. And then, we switched to a different protocol. And in the end, we did have a successful transfer. And so I remember exactly where I was the day it was when I got the phone call the first cycle that I didn't respond. And I mean, in my mind, it's like, you drop the phone in the car dealership and you felt like the whole world like stopped. And my husband's like, what? And I'm like, just didn't work. It didn't happen. I remember feeling like it's not done. We have to keep going. And, that wasn't easy. We had a couple more rounds where it was not successful. It was summer, and my husband saying maybe we just need to take a little bit of a break. He said, it's not like anything has been taken away. Like, we have a really good life and we're happy. And I appreciated that, but I also said to him, it's really hard for ladies to just not think about it.
Exactly. When there's the light switch that I'd like to think is attached to our heart that we say is the maternal switch.
Right.
Whether you have had a pregnancy yet or suffered a miscarriage, if the light switch is on, a loss is a loss is a loss.
Yeah.
So something not taking was a loss for you.
Right.
And that's a valid thing. And
absolutely.
Sometimes explaining that to others can be a huge challenge, and no offense, men, especially men. It can sometimes really be hard for them to see why we would be much more emotionally attached to each try.
Right. We have a monthly reminder of that, what's happening with our bodies, and whether you're tracking and you're not having any issues, once you're aware of what's happening with your body, which I think is one very empowering thing about fertility, is, knowing exactly what's going on pretty much throughout the month, and just knowing that your body is working the way that it should, even if you're not getting pregnant. We did take a summer off, and I remember it was almost like I'm just watching the clock for the end of August, and I'm like, okay, are we going to start up again? And he's like, I hadn't been thinking about it.
And it was all you could think about.
And that's all I could think about. So we did. We went back, and by the time we got back into things, and in January we got pregnant with, we didn't know it at the time that it was twins. But if you've done fertility, you go in and they tell you, we did the transfer. They tell you don't take home pregnancy tests, and
oh dear,
like just wait for your blood test. And like every good patient, I promptly went and bought sticks.
You know what? On behalf of everyone listening, Dr. Gefroh, thank you so much for being. I'm taking my doctor hat off right now. My know better hat is over here, and I'm going to do what every woman wants to do right now.
Totally. So I did it, and it was a Wednesday, and we were supposed to have our blood draw on that Friday, I believe. And so I got up early, 5 a.m., want that first time of the bathroom. Yeah. I think I see this little pink line, and I just waited. I remember just waiting in the kitchen until my husband got up, and I showed it to him. And he looked at me and he said, well, we should really wait for the doctor to tell us.
That was not the reaction I was hoping for.
And I was like, well, I'm just going to be a little excited over here by myself then for a while. And then I thought, wait a second, I am a doctor. So we kind of chuckle about that now. And then I remember I went in for my blood draw, and they said, did you do a home test? I'm like, of course I did. And you know what? After going through the fertility stuff, and I still tell some of my patients this now, I did the home pregnancy test. There was something just so joyous about that moment of what every other woman potentially in America that's thinking she's pregnant, just peeing on a stick and seeing a positive and just feeling like normal for a few seconds. So.
You said the magic word, the normal. If we have had a loss, if we've struggled with fertility, whatever, sometimes you just want to be normal.
Right.
You just want to have that same feeling that you're seeing everybody else have. Social media, we see it constantly.
Yes.
And I think that is especially for women, lost mom friends who have lost babies, because so have I. That's part of my journey. And they share so much fertility issue stories as well about about getting pregnant, keeping the pregnancy, and just wanting to feel normal. Every pregnancy announcement, every birth announcement can be like really difficult on your heart. Yeah. Did you feel that at all going through your time?
There was heightened awareness of it. So it felt like there was an influx of patients when I was going through fertility issues that were like, yeah, I can't believe I'm pregnant again. Or I don't know how I got pregnant. Like just some patients that their pregnancy is tougher and they have a harder time when they're pregnant. And so I would just in my mind try to remember that that's their journey and not mine. Yep. And maybe try to shift the focus and say, well, let's just talk about like something that's good about the pregnancy. Just tell me one good thing that you're feeling about it today. And sometimes we would struggle a little bit for them to come up with one good thing, but that's okay. I would just kind of laugh sometimes to myself that it's really interesting that this is my career path and, having fertility issues. And maybe that's just going to make me a better, more compassionate, more understanding in the long run. There's going to be something that would come out of it that was going to make me stronger, more empathetic, etc.
Wholeheartedly believe that. And I think what's so beautiful is that you being a provider and having that empathy and just being so real and that warm knowledge that you're passing on that is firsthand, that goes so far in my mind, since obviously I'm on a different side of the thing. I don't have MD blah, 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 blahs behind my name like you awesome people do. So when we get that, I think that makes a world of difference. Yeah. It's that little extra that you put on top.
Yeah.
One final thought on fertility, because I'm going to dare to ask this.
Okay.
Because I feel like an answer I've been given before by medical professionals is that stress might play a part in fertility and pregnancy as a whole.
Sure.
But does it really play a little bit bigger of a role? Present day in COVID times,
sure.
One of my best friends delivered a baby this year. And I have other friends who are pregnant. And it just feels like the amount of stress and anxiety is tenfold that a lot of other women have had to go through. So how much stress really does play in fertility and also pregnancy?
Sure. I mean, I think it obviously plays a part, but it's hard to turn it off. Yeah. So I can't say that if you have stress that, it's a detriment, that you're not going to be successful, whatever you define as success as far as, is it that you want to get pregnant or have a healthy pregnancy? Yeah. But it does play a part. And I think just on our mental health, maybe more than anything, there's definitely enough women that have had fertility issues and then decide to stop for a little while, or maybe they decide to pursue adoption as how they're going to grow their family. And then they find out on the way to literally go pick up their new child that they're pregnant. I've had that happen to patients of mine. And so you have to think that stress plays a part in it. And during pandemic times, there were a lot of different theories that we would see lower birth rates, we would see higher. Right. It's probably a mix between the two. I mean, if you're
it's so early to tell.
Yeah, I mean, we've definitely had a big jump in our OB numbers at Essentia in September, but I don't think it was necessarily unplanned. I mean, I think that a lot of us did a reevaluation of our life under stress. You're home. There's a lot of time to look around at your surroundings. So either you're thinking of home improvement projects or things that you haven't done that should we expand our family? Is this a good time? Maybe we shouldn't expand our family because it's not a good time. So I think it's a time where all of us were doing the
reevaluation of the heart, right? Yes. There was a little bit of like, what do I really find important right now?
Right.
What do I, cherish most? And if it's family, I can see why your clientele went up a little bit there.
I think that's so important to talk about, like, what really matters to me.
See, this is where I feel like sometimes people just don't think they're going to get this kind of conversation with their provider or with their OB or with their gynecologist, that you guys, you really go extra. You're not looking just at the parts, what's going on in your mind. What is your heart leading you to? And this is, once again, one of those things that I always think makes it the level up. It's, here's the crowd, but you're looking for the head above it.
Sure.
So I just love hearing such warmth coming from you. Let's shift a tiny bit and talk a little more about gynecology and services. I'm going to get right to it.
Okay.
You use robots to do surgery on a vagina. I mean, that blows my mind. First question, do I want to be a woman that a robot is doing surgery on my vagina? I know you're trying so hard to answer with a straight face.
No, I just think it's cute maybe to me because I've had a lot of spouses or significant others or family members that they literally think that I grabbed a cup of coffee, I got the robot hooked up, and then I left for a little while and came back, which is really it's laparoscopic surgery, which has been around for a long time, and we wouldn't go through the vagina, so the robot wouldn't be in that area, it would be in your belly.
And I'm being dead serious. You would think a 41-year-old woman, mom of 5, would know that, and I didn't know that.
It's not like everyday conversation.
Right.
It's okay that you wouldn't know that. So, the incisions for the robotic arms are the same as if you had a traditional laparoscopic surgery. So, and laparoscopic surgery has been around since like 80s.
Yeah.
It became the norm for a lot of different services.
Yeah, lots of different operations. What continues to just kind of blow my mind is advancements that happen, constantly.
Constantly.
To the point where this isn't right body part, but at least woman. My mother's had 2 hip replacements and now 2 ankle replacements.
Yeah.
Over the course of the last 12 years. When we're talking about surgery and robotics and the advancements that have come along just in a decade's time, do you get like nerd out, geeky excited over that kind of stuff?
Absolutely. I was really resistant. I don't like change in general, and particularly when it comes to surgery. If you look at data about successful surgeons, it's about repetition. And oftentimes it's about doing the same steps every single time to produce the same outcome. We want a good outcome. And so when I was approached about doing robotic surgery, I was very happy with my laparoscopic practice, and I didn't know that I really saw the benefit. I think one of the misconceptions that some, robotic surgery will somehow make you better, and that's not the case. It's still you. We can't get away from ourselves. So, good point. So you have to have that foundation. And once I went to training, I thought I'll give it a try. I was really excited about how it could improve my practice, just the OR time in general. So, where it gets really exciting is how it mimics your hand movements, and you can get deeper into the pelvis if you need to. So these patients that maybe I would have said you need to have a big incision, there are some very unique circumstances where I may open somebody, but it's very rare these days. So
that's crazy.
Yeah, it's exciting for patients. And when I think about my grandmother had a hysterectomy in late 70s, early 80s. When she passed away, when we were going through her things, somebody found like a hospital bill from her hysterectomy, and she was in the hospital for 10 days.
Wow.
For a hysterectomy, and today our patients go home the same day. So you're right. Like, it's mind-blowing of how much things have changed.
Really personal, because my grandma has shown me her hysterectomy scar.
Oh, great.
That alone. I know that's you. Bottom of belly button all the way down.
Yeah.
And I know a lot of cesareans were done that way in those days as well. But you don't have that kind of scar situation. Things really have advanced in marvelous ways. We don't have to look like Frankenstein.
Right. Yeah. And at healing time, those big incisions, even aside how they look, healing, it's just a much greater challenge. All the tension that is on those incisions, especially ones that are vertical, even the horizontal ones. So I think the healing time.
That's exciting. And you kind of humbly share that, but I have heard time and time again how great you are specifically in this arena. So I wanted to just point that out, because you really come off as a quite humble person, which I find endearing. However, I also like to pat on the back when it's due, and definitely do for you.
Thank you.
Is there something specific that you love as far as like a wellness nugget that you'd like to pass on to women?
what I tell a lot of women, like many people, when I think I'm going to take on something, I'm 0 to 100 in my mind. And I think we set ourselves up for failure that way. And so, when we talk about healthy diet and exercise, and people will say, because I am fit, I come by it pretty naturally. So, I can't say that it's because I have this clean diet and whatever. I mean, but I do take certain steps. And when I made a decision, it was early on in my sobriety, I needed to take some time for myself to reset my brain. Because when I wake up, I'm not this person that you have sitting here with you today. I'm generally a little bit cranky, a little bit off kilter, and I call it my default settings. So I needed to do something in the morning to set my mind right. And I did it in the form of reading some meditations and then exercise. And I knew that if I said I'm going to exercise 60 minutes every morning, it was never going to happen.
You were kind of setting yourself up for failure if you bite off more than you can chew.
Exactly. So I said I'm going to do it for 10 minutes. 10 minutes, and during that time, I'm going to set my mind right by being grateful for the good things in my life, talking about the things that I'm scared about, and then go about my day. And it works. It works for me. It may not work for everybody, but pretty soon, I had so much to sort out in my mind. Then I'm exercising 20 minutes while I sort out my head, and then 30 minutes, and pretty soon, then you start. People start inviting you to things like solid core. Yeah.
And the next thing
wait a second here.
Prior to that, you might have turned down that invitation because of 100%. Being intimidated or whatever. What? Those fit people? I wouldn't be able to keep up with them. But now you have this confidence. It's a really great piece of advice. And so normal. Sometimes people get so concerned that when you go to your doctor, it's just going to be completely science-based.
Sure.
But I feel like you have a good connection with mental health as well, because what you're speaking of is get in touch with yourself and meditation and gratitude. Studies keep pointing and showing that, that's good for us.
It is. And once you make that part of your day, I can tell pretty quickly just little things throughout the day where maybe I'm a little bit short or I'm frustrated. It's a big whoa, I need to do something for myself.
Yeah.
Because people sometimes forget that it's an inside job with some of those ways that our frustration comes out.
That's so true. Good piece of advice. I'm actually inspired, legitimately. Okay, note to self, get up 10 minutes earlier.
Just 10 minutes.
Just 10 minutes. Okay, I thought it very intriguing that you have some relatives that you like to pass along a piece of advice. And I think it's so applicable for your field, but also all women can hear this and should hear this.
Sure. Well, occasionally my nieces have come to me with things that they're upset about or, maybe choices that they've made. And I've had to do this with myself because obviously as we grow in our lives and we change and we age, our lens of the world changes completely. And so, I tell them that we all make decisions at the time with the information we have, and we do the best that we can. So you really have to not do that to yourself in a sense that later on you look back and go, you can say maybe that I wouldn't make that decision today, but you always have to trust that you made the best decision that you could at the time with the information that you had.
That's excellent. And I think so important to know that for if you're listening and you are struggling with fertility, because we all have a tendency to look back and go, I should have, would have, could have when I was younger, or do this or do that. But you're right. We have to do the best we can in the moment we're in.
Yeah. I mean, if you think about parenting, about marriage, about relationships, about work, it really, I go back to that advice time and time again.
That's a true north.
Yes.
That's a default setting right there. Well, Dr. Gefroh, this was an absolute pleasure, and I'm sure we will be asking you back on this podcast in future because you are a wealth of knowledge and just a joy to talk to.
Thank you. Fantastic. I enjoyed being here.
I thoroughly enjoyed that conversation with Dr. Gefroh. She gives me massive female empowerment vibes, and I'm feeling good. I'm really excited for what the season has in store for us. In fact, episode 2, for fear of sounding like a bad Friends episode title, this will be the one where they poop. Yeah, it's going to be a
poop episode. We're going to have an amazing GI doctor on with us talking about it. It's okay. We have a safe space for us to talk poop on the next episode of Dare to Ask, sponsored by Essentia Health.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Want to know the secret to a great night's sleep?
I'm listening.
It's the GelFlex Grid, and only Purple mattresses have it. It's made from a hyper-elastic polymer that instantly responds to your body. The GelFlex Grid is why Purple mattresses are soft where you want it and firm where you need it.
Wow. Tell me more.
It flexes around pressure points, keeping you supremely comfortable. Plus, the GelFlex Grid has over 1,400 air channels that let hot air flow away from your body, so you sleep sweetly through the night. Learn more at Purple.com. More at Purple.com.